Peace be upon you and God's mercy and blessings. I previously made a video about the new treatment used for nasal polyps caused by allergies, which tend to come back after surgery once or even twice. We mentioned that the most important reason for the recurrence of polyps is this. It's that the allergy remains present even after the polyp is removed. So the allergy that caused these polyps in the first place is still there. After the surgery, it's necessary to use the treatment that we've always used for allergies. This consists of antihistamines and, of course, corticosteroids. Usually the patient would have the surgery and leave without taking any medication. Then the polyps would come back again because the allergy itself is still present since it wasn't treated. So what about antihistamines? And corticosteroids? These were used to treat the allergy by counteracting the effects of histamine or all the mediators of allergy, all the chemical substances released in an allergic patient. We work to block their action. We block the action of histamine with these substances. These are the antihistamines, the allergy medications, or corticosteroids, which stop inflammation or the substances released during inflammation. These treatments had their own problems because we know that when corticosteroids are used topically, their effect is somewhat weak. And when used orally or by injection, they can be harmful because they raise blood pressure and blood sugar and can cause some bone fragility. They also cause problems like stomach ulcers and other well-known corticosteroid issues. As for antihistamines, histamine is still present and we take them anyway. The tablet works for 12 or 24 hours, and after that, it doesn't do much more than that. It just counteracts the effect. The new medication that's being used now has a much smarter concept. It doesn't wait for the chemicals that appear during an allergic reaction to show up and then counteract them. No, it actually prevents their formation in the first place. It works on the small components called interleukins. The substances, the chemicals that appear during an allergic reaction, it prevents their formation from the start. And this is a new concept in medication. Basically, instead of waiting for an army to attack us so we can fight it and maybe win, or rather, no, we prevent that army from forming in the first place. We don't let our body help it gather equipment, weapons, and soldiers. No, we stop the formation of the army itself that appears during an allergic reaction. So there isn't even a problem to begin with. That's the idea behind this treatment. The only issue is that it's a bit expensive, but so far it hasn't shown any side effects. The results are similar to the surgeries we do to remove polyps. When we give this treatment, we find that the polyp is as if we've removed it, just like we would have surgically. So that's really excellent. Most people who've tried it have praised it highly. It saves us from having to tell the patient to come back again, to do another surgery for you after you've already experienced the pain, seen the blood, and realized the risks of going into surgery, especially for these patients. These patients often have issues in their chest as well, and anesthesia is difficult for them. They're at risk that the second, third, or fourth surgery becomes even more dangerous than the first one. I'll provide you in the comments the scientific name of the medication and how to use it, God willing. It helps a lot of people, whether they've had the surgery once or twice, or if they don't want to have the surgery at all, so that this adenoid does not come back again, God willing. Wishing you all the best and a speedy recovery. Please subscribe to the channel and like the videos so we know they're helpful to you and that you're waiting for more from us. Wishing you a long and healthy life.